to take some time and talk about adjusting. We're talking about lower back adjusting, adjusting the lumbar spine and the side posture push move, which really, in my opinion, is maybe the most important adjustment in chiropractic today. Now, that's a pretty bold statement, but it is the adjustment, in my experience, having given like 1,000,000 adjustments now, that will change people's lives more than any other. Yes, if you get your atlas messed up, it's going to be a life-changing adjustment also. Any adjustment can be life-changing when it's the adjustment that you need. But considering that low back trouble is second only to colds and flu for missed days from work, it's the most common surgery. It's the part of the spine that rots out the most. It's the one that chokes a nerve. The nerves going to all of the organs from the belly button down. I mean, it is the center of the body. It's the hinging point for the body. It's your key to ambulation, not, I was going to say ambulancation. It's your key to being able to walk, and we don't end up with a walker or even a cane or a wheelchair, because those are usually because of a lumbar problem. I mean, it's everything. And it's the problem out there that more people have than anything. More people out there have lower back trouble than any single thing that they'll go to the chiropractor for. Then you got some neck trouble and you have headaches, but they're not anywhere near what's happening with lumbar. So your ability to work on the low back is key. And of course, there's a variety of techniques, but I'm going to be focusing on this particular technique if that's of interest to you. If you're doing other things, great. But if you want to be good at this, I promise you we're going to help you here today. Now, I've got quite a few points here, as you might imagine, me having an outline. But I'm making this because there's all these mistakes being made everywhere I go. And so things aren't moving as much. You have to work a lot harder. It doesn't move thoroughly. Something clicks, but it's in the wrong place. And then the chiropractor says, there, I got it. You didn't get anything. Okay? There's a disconnect between what the chiropractor is thinking and their ability to understand what the patient is thinking, what the patient is feeling, which is, by the way, all that matters when you're adjusting. But most chiropractors really can't get their mind out of their own head. We'll talk about that here too. So we want to make these improvements to make it easier so you have more confidence, you can help more people more thoroughly, and change more lives with chiropractic awesomeness. Now, but who am I? And I'm not going to sit here and talk about whether or not I'm qualified to talk about this, okay? But I will just do a quick little history. I was very fortunate. My very first chiropractor, graduated Palmer in 1969, personally trained by Gonstead for 9 years before Gonstead passed away. And I look back at my time around him at really how good he was. He might be the best lumbar adjuster I have ever known. And I've known a ton, okay? Thousand plus, okay? Way over that probably. Okay, but he is still probably the best, has the best feel, the best touch, the best understanding what's happening with the body, depth, tone. He's incredible. I'd give anything to have him adjust me right now, but he just retired after 50-something years in practice. So I was fortunate that way. Then what happened here too, when I was in chiropractic college, I was a president of the Gonstead Club and all this stuff, but I also had a chance to intern with John Thatcher, who graduated around 1955, and he trained with Gonstead for over 20 years. And he was one of Gonstead's best friends, actually. In fact, he's one of the 5 people that Gonstead wrote a letter to, authorizing him to be an extension of himself when he is gone. Top-notch chiropractor, completely fearless. I could tell you Thatcher stories, as can many. In fact, if you're in the Gonstead world, you don't know who John Thatcher is, but you're one click away from anybody who does. So I was very fortunate what I was around in my early training, okay? And what I see happening now is people who are teaching it don't teach it that well, and then it doesn't get learned very well. And in fact, many times if a chiropractor, oh, this guy's in practice 30 years. Yeah, they got 30 years of not doing it well. They can get some stuff to move, but it doesn't move as much. It doesn't move as thoroughly. The patient doesn't like it as much. They can't rely on it as much. You know what I mean? So we can all get better. I want to get better. Even though I'm about 130, 170 visits a day chiropractor, I'm in my like 30th year of being into chiropractic now. Okay, I've done whatever you want to do in chiropractic. I've pretty much done it. I don't know anything. Okay, I'm still learning, and I want to continue to learn. And as soon as you're around a chiropractor that thinks they know something, you're in the wrong place. We're always learning and wanting to get better, and that's why I want to make this video, because it'll make me better too. Okay, all right, now. The lower back adjustment using the whole body here is probably the most difficult adjustment to give, along with, say, a legitimate C7 or T1 cervical adjustment sitting in the chair. Okay. That's almost impossible for most people in chiropractic. This adjustment here also very difficult. Why? Because we're dealing with the whole body. We have to control the entire body, not just our hand over a thoracic or even just the head and neck. We have to control the entire body, everything above, say L5, and everything below. So it's all of the person's body plus everything we have to do to make the adjustment. Okay, and look at the points of contact. We have our hand, we have the contact, we have what's happening with our legs. We're dealing with the patient's shoulder, we're dealing with the spine, and then we're dealing with the patient's legs. It's very complicated. There's planes and angles and vectors, and we have to get all of this lined up and focused so the force goes through the vertebra that we want, okay? It's very, very difficult. In this training, I could easily spend 20 hours. In fact, I could probably do a 100-hour course on this, but I'm so busy with my regular consulting, I can't get too hung up with technique. Now, what I'm going to do here now is I'm just going to rattle off what the biggest mistakes are, and then I'm going to bring somebody in here and I'm just going to demonstrate all of this for you, okay? But this is sort of a crash course. I'm just trying to get right to the meat of all of this for you. Here are the biggest mistakes. I'm just going to verbalize them, and then I'm going to show you, okay? And I've got a whole list here. The first mistake is people want to use the wrong table, okay? Or they get one of these tables and it's covered in vinyl because it was cheaper, or, you know, they thought it would work the same. No. The fabric on this table is critical because it grabs on to the person's clothes and it holds them in position. Okay, I've got the nice leather table here on the TR1. Okay, can you adjust people on it? Yeah. Is it as good as this? No, not even close. Why? Because the table is slippery, it's not all smooth, you don't get your head positioned right. The pillow here is designed perfectly to fit in this space to keep the head and the spine level. All right, so it's a wrong table. Okay, we can do side posture adjusting. I've slid many a mattress out of the way and adjusted people on a box spring in a hotel if I've had to. But this is the ideal table, the real Gonstead, okay, or the CC Richie Lou table with the fabric to grab onto the person and hold them there. And of course, the table at the right height. Even the density of the foam, how the foam comes over the corner, this is a lot more high tech than it looks. So one of the first mistakes is having the wrong table. All right. Next thing is this, is people get positioned wrong and they're not at the correct distance from the edge of the table, which I will show you in a minute. Then next problem is they got their foot wrong. They got their foot going off the end of the table when it must be going off of the corner of the table, which I will show you in a minute. The patient doesn't go on parallel to the edge. They go on rotated like this. The head is always in the center of the pillow, but their foot goes off the corner as if to bring their spine closer to you so you can get over and work on it, okay? You'll see how this works in just a minute, okay? Next problem is they're not on their shoulder blade right. We have to get their shoulder blade set underneath them properly. Then the arms are wrong. The arms get too far forward. And here's one of the epic mistakes I just can't even believe I see, is the stabilization hand is not in the right place. It's here, it's on their elbow, they're crossing. It's just, it really can only be one place if you want to make the adjustments as easy as possible and have them be as good as possible and have the patient be as comfortable as possible. I'll show you that in just a minute, okay? Then the head must be flat, no rotation like this. The ear is flat on the pillow, and that's what we say, ear flat, okay? All right, and then even how to tell them to get on the table. It's the gesture, and then right on over, put your ear flat on the pillow. We swing the legs up, okay? Then their knee can bend. There's quite a few things that can start to go wrong. The footwork that is the feet are facing, you're facing the table too much like this when we need to be more like that. Should be equal pressure on all 3 points of contact. And one of the biggies also is the chiropractor loses the leg. When the person brings the leg up, okay, you have to hold it. You can't just back away and roll the person to you. They hate that. I hate that. Everybody hates that. And somehow that gets taught, and it's horrible. Okay, it's just horrible. There's a better way. Okay. Another thing that'll happen is someone will be laying down and the chiropractor will kind of like rotate their pelvis toward the doctor. And of course that locks up the TL junction and makes a big, huge mess all of its own. It's horrible. So many times the foot's not in the right place. They lock up the TL junction, have their hand in the wrong spot, arms are in the wrong spot, roll the person over, making them all spasm up, okay? Then it kind of goes click a little bit and then go, ooh, I got it. You didn't get anything, okay? You got like a 2 instead of a 10 that was possible in that particular situation, okay? Stabilization hand, losing the leg, no leg control, all these things can be problems. So I'll bring somebody in here and we'll talk a little bit about it. In fact, let me do this. Just for fun, speaking of some of you, because you might be Gonstead people, I'm going to show you right now. This is the nicest original porcelain white nervoscope probably in the world, still in the case. Look at the cool case. Okay. It's like brand new. Nervoscope with absolutely perfect movement. Look at the needle, it just sweeps so beautifully. One of my prized possessions. And other people know the story, but I walked into a Gonstead seminar, which I've been to like 30 of them. I used to remember I used to practice like 12 minutes from the Gonstead clinic. Okay, I used to borrow their view box when I would have to do talks in schools. Okay, I've been swimming in the Gonstead world as much or more than anybody for a long time. Okay, now, a guy walked in and he opened up a briefcase and he had some nervoscopes and said, does anybody want to buy an old nervoscope? I ended up being able to buy 2, one for myself and one for a buddy of mine who I knew would want one. This guy did that and he paid for almost all of his chiropractic college education. He found like 40 of them and sold them for like $2,000 a piece. An incredible story. But anyway, but I do have to say something. If Henry Ford came back, would he drive a Model T? If Gonstead came back, would he still use one of these? He might, because it's still valuable, it's instant in its feedback, no computer necessary, and you're right there with the spine where you can palpate and do your work to determine where your adjusting is going to be focused, okay? Also, as a lot of you know, but I have a cool technique mastery set that a lot of people buy where I'm actually adjusting real people in my last office, okay? So if you want to see some real adjusting of a variety of different things, footwork, what your eyes are doing, this might be one of the best that's out there because I'm actually adjusting real patients, not just sitting and talking or demoing like I am here today, okay? Now, I want to show you something here just very quickly, just to give you an idea how subtle this is, okay? I just want you to look at this. Look at this picture here very quickly first in this Gonstead, basically it's a Gonstead book, okay? All right, so here you see one of the Cox brothers, legends in chiropractic. I want you to see where the stabilization hand is. I wonder if you can see this, okay? Okay, let me focus you in here a little bit, all right? It's right here. You see the shoulder here, and you see how the hand is in front of the shoulder, okay? Now, what's too bad here in this production is they wore a white shirt, a white gown, and then they have a white background. So that's sort of a production error there to make it, it's hard to see. But what I want you to compare that to is the picture below. Okay, the picture below has the hand up on top of the shoulder. Let me show you another example here. Looks like this. Well, actually, here's Gonstead again. Look where his hand is. See how the hand is in front of the shoulder, not on top of it, okay? Let me go back to this one again to see if you can see what I'm talking about here. Yes, right here, the tip of my finger, you can see. See how the elbow here is farther forward and this hand is on top of the shoulder? It's not in front of it. This will be much harder to adjust because you'll be adjusting into slack. The balance will be on the body will be too far forward, and this traction headward won't put the tension in the spine that's really required. It'll make this adjustment more difficult. Now, they may just be showing the contact point here, but I'm just telling you there's a massive difference between what you're seeing here and what you're seeing there. Two completely different things. This is perfect. See, there's basically 90-degree angles as I'm going to show you. But I just want you to be aware, you'll see different examples of that in books. And I want you to notice it in real life, and I want you to get really good at it yourself. Okay, let's bring someone out here and let's go over this more realistically. Okay, so I'm going to keep my notes here because I'm going to need them because I want to make sure I have everything. Everybody say hi to Brittany. Brittany, just jump down and face me and then put your, well, I'll just go through the routine here. Watch this. One over here on this side. Okay, down you go. Ear flat, facing me, like so. Okay, so we have her generally on the table in position, Okay, now I'm going to go over what these big mistakes are first, and then I'm going to kind of go over what to do. But I want you to be aware of these things. So if you do any of these yourself, you can make some corrections and give it a try. And if you see it in other people, you're getting adjusted, you can help them out too. We want to get better at all of this, including myself. Okay, so I'm just going to go through the sequence here and explain things as I go. Of course, we got the correct table with the right grip, and she feels with her fabric, she's kind of gripped to the table. It's not slippery. Okay, so we always go in a sequence. Okay, we always go in a sequence from the foot all the way to where we make the adjustment. So we always start here. And the first thing we do is, I want you to know this, and a lot of people who know me already know what I'm going to say. Our fingertips from this knuckle up never really touch the patient. We're never grabbing. Like I will tell you, she doesn't like this. She doesn't like that. Okay, but she's okay if I do this. See the difference there? There's a major difference there. It's a major difference. Remember now, you have to think like she's thinking what's comfortable for her. She's sitting there right now. See, are you aware of her? She's going, she's expecting something. She wants to be comfortable. She really wants it to be quality. She wants it to be ultra professional. She wants to feel skill and precision. She wants to walk out of there better than when she came in. Okay? All right. So she has all these things going on in her mind of what she wants to think and what she wants to feel as you make the adjustment. See that? But the chiropractor is just kind of, you got to think about her. So over this leg gets straightened, but watch, I use the back of my hand. I use the cinnamon roll, as we call it, like this, and I get that foot off the edge. Now, what I want to say here is that lateral malleolus is right here. Like the foot is half on and half off. It's never back like this, ever. And the foot is never off the end of the table. It is always there, just like that. So and her head will be back in the center of the pillow like this. So the head's in the center and her body's kind of coming down at an angle like that. It'll make your life much easier. Plus, watch this, Brittany. If I do this, do you feel how what it does is it kind of locks up your low back. And our whole thing is to try to get it into a state like this. But watch, when I do this, it just takes that little bit of tension off the lower back. I can't even tell you how important that is. Okay? So that has to go there. Now, when this leg comes up, that foot goes into popliteal fossa, and then what's going to happen with me is I'm going to be looking down. Now, I'm looking in this zone right here, okay, which is a very careful area to be looking. So I have to tell her what I'm doing. I have to make sure that your leg is about halfway off the table. So that's when I take the cinnamon roll again on the knee and I go like this. And again, I'm not being grabby like this ever. No fingertips ever. It's like this, a little bit closer to the edge. Go ahead and scoot with me. You scoot, like that. And what I want, and I will tell her, I want the middle, and I'll just barely touch. I want the middle of your leg at the edge of the table. Now she knows exactly why I'm doing that. And if I adjust her 500 more times, she'll know why I just did that. Because I've got to get her femur halfway off the edge. Okay? Now we're close. Now something happened here, and I want you to notice this. You see how I immediately got her leg like this? See, watch. If she brings her leg up and that just hangs there, okay, she's okay, but she's kind of having to hold it a little bit. It's caused a little muscle tension there, right, Brittany? A little muscle tension to hold the leg. This is one of the biggest problems in lumbar adjusting, is you lose the leg. So the second that comes out, the top of my kneecap catches her tibial tuberosity like that. Do you see how I just have you now? But watch this. I'm not doing this. See the difference? It's just there. She knows I'm there, and now she knows she can't fall off. She knows I've got her. At this moment is the moment where she starts to trust me, right there, because she knows I'm caring about her and making sure that she's comfortable, okay? We'll talk about how high or low this goes in a minute, all right? It has to go here because if you don't, you lose the ability to create tension. See, this is no good. Nothing will move, and we won't eject the knee up to her chin because that's too high. Now, so we've got the bottom half is perfect. Now, a lot of times as we bring this leg up, they'll curve this leg back. And once I'm here, I can just grab the back of the shoe and just bring this around to make sure it's there. They'll want to bend that leg, okay? All right, so now we're good from L5 down. Now we have to fix L5 up. But notice I've got her. See how I've pinched her right here just like this? Okay? See that? Here, and I've got just this, just enough that she knows I have her, that's all. But I have this control. This is the key right here. This might be the key to the adjusting. What's happening here and with this hand are the key. This is easy. It's these that are the key. So now watch again. Watch how my fingertips don't touch her. See how my fingertips don't touch her? Like this. And then I'm going to go here, elbow down, and now she's set on the shoulder blade. And then watch what happens here. And I have to be very careful because of the area of the body I'm dealing with. Again, no fingertips. I'm going to bring this back like this and let them cross. Now what happens here, now she feels even better because see the elbow in the back balances the knee in the front. So if I let go, she has a little bit going, watch her knee pop up just the tiniest bit because you had a little bit more back that way, right? But if this were here a little bit, right, there's a point where she's perfectly balanced. You sense that? She's perfectly balanced. And many people have people sitting there like this. It's horrible. And then they grab like this or something, and they got their hand down here. This hand only goes one place only. Everything else is wrong. Everything else is a disaster. This elbow goes back to counterbalance the knee, and the palm of your hand gets right on that anterior deltoid, just like that. Okay? So it's like this. See these 90-degree angles? Like this? So this goes here. It's almost like this hand is here, okay? And then, of course, we have the contact hand. Nothing is here like this. Nothing is pushing this way. This is never up here like this. Because we have to do this. Think about this. I have to create tension in the upper body, get the lower body set so I can isolate her low back. And if this is all mush and slop, okay, right? I'm going to just push it, and this is down too low, and I lose her leg. It's called leakage. It's just slop here and slop there and no tension. It goes click, and then the chiropractor goes, oh, I got it. Okay, and she walks away going, well, it was okay, but it's not like the other guy, or it's not like the gal that I like to see across town. You get the idea? So we're here. This goes back to balance. Now we're right. Now notice this is on top of the other hand to hold it there. Okay, now that's all done. Now basically, most of the adjustment is done. Most of the adjustment is done. Okay, I watched a great jiu-jitsu tournament, and there was a breakdown of a high-level competition. And as it was being broken down by the experts, there was one position that they got in, and the guy said, the match is over. And everybody's going, how is the match over? That you just got your hands on the guy. Well, and he explained why the match was over. And sure enough, the guy, and it was over. And right now, the adjustment is mostly done because the leg is positioned, her shoulder is, her head's flat. I've got this, her body's in the correct state. Now watch what happens. This is where it gets lost. I have to get her over into position without losing any of this. Now here's what gets taught commonly. Here's how bad this is. Let's say this is here. Okay, I'm going to tell her she's going to hate this. Okay, but that won't program her. She is just going to hate it. If I do this, Brittany. See that? I want you to compare that to this. I have her here. This is back to balance, okay? And feel this. See how I have you now? And I bring your body over. It's so huge. This right here, I feel this right here, and the person's back, and they go like this. Oh, she has to hold her leg. Nothing has her on the front. As soon as you touch this, it will never let her go. Watch this. This isn't a position. This leg, I will never let her go. I've got her. Look at that. I've got her. I'm only on one foot. Now I've got her. Equal pressure. See that? It's not this. Equal pressure. Equal pressure. 3 points. I have her into position with balance, and my footwork is correct. Many people are too much like this. It's this. Because I've got to get my xiphoid over the top of that L5 because that's the force that I'm using to move that vertebra. Now, I want to explain something here too you're going to find quite interesting. Many times as you're adjusting like this, you think you're here and you're going to like shove on something. But I want you to look at it like you're trying to take these spinuses and go like this with them. Over here so you can see. Like that. Like your back's like this, Brittany. I'm trying to take these and go like this. See that? See how if I do this, I'm kind of going in that direction right now. Okay. And if I hook onto here, okay, it'll go and it will feel glorious. Okay. All right. Okay. Now. Okay. So now as I bring her into position, I'm just going to kind of follow through with this just a little bit, and then I'm going to talk about a couple of other things because basically this is the bulk of it right here. All right. Gentle. Get my watch out of the way. Very gentle here, but see how I have her like this? And I'm not pushing back, it's just kind of here. I don't have to do much, but I have it here, okay? Now I'm not gonna do this. Watch how her body rotates. See that? It's not that. Watch, her whole body will go toward me like this. What you have to understand here is this is not a move that's going like this. What's actually happening, and this will seem wild, is it's actually going like this. There's a plane right here. If I rotate her body over 45 degrees, and you can see it from this camera angle here, there's a plane, okay, comprised, like right now she's on this plane, if this is her L5 right here. See that, how it's kind of level? But when she's ready to be adjusted, it's going to be closer to, like, say, 45 degrees, okay? So there's like this plane that the spine is in, okay? Like right here, see that? Right here, going straight through like that, okay? So if she's on the side, see, there's the angle like that. We're pushing this way to adjust the vertebra, okay? So you see, this makes a plane like this, like a vertical, like a sagittal plane right through the center of the spine. If you're laying down, it's like this. And if you're on the side, it's like that, okay? And so what we're trying to do is get all the force going in that plane, okay? Basically trying to take the low back and do this with it. Watch. Like that, in this plane. We're not trying to do this. We're not trying to rotate it, okay? Now you have to sort of conceptualize this, but follow. It's as though I'm going to hook onto her L5, okay? And I'm going to bring it around, and I'm going to take, and I'm going to go like this, okay? We're going to take, and this leg comes up. Okay, the adjustment is made with your lat. You're not pushing with your chest. It's with your lat. Watch what happens with my piezoform here as I do this. Just watch. See that? Now put that on the spine, on an L5. It's the perfect angle you want to have happen. You're hooking under the L5. You want to get lift on it and move it forward. You can't push. You'll rip out your shoulder every time. So the move is made, watch this, with your lat. It's not shoving this way. It's a lat move. So I'm going to fall with a little bit of space between myself and her hip, and the lat is going to come in because that's where the leverage is. That's the force. You can't, it's very, very powerful. This is weak. This is powerful because there's leverage there, okay? So watch, it's here. Watch my elbow here. Okay? And now what's happening when we're in position there is I'm about 4 or 5 inches, okay? Because that gives me the room to drop. Because as I'm pushing here, okay, and her knee is up, okay, I have to have room to fall into her and kind of, I'm pushing forward and I kind of catch her body and it's boom. See how I'm going to kind of hit her hip with my rib right here, okay? All right, good. I'm going to unwind you. So go ahead and sit back up. You've been down there for a while. Just relax for a second, okay? Now I'm going to flip over to the other side. I'm going to go through the routine again just so you can see it and really follow, okay? So it'll be have a seat, calm hand gesture, okay? Down you go, ear flat, and of course I'm going to have a sheet of paper down there, okay? And then here we go, watch. I'm going to get that bottom leg straight, but no fingertips. This comes up, okay? A little bit closer to the edge. There we are. And see how I'm using the back of my knuckles here? I'm not grabbing. I like to grab the fabric here on jeans, if they have it, or sweatpants. Knuckles, this foot goes up, okay? Then I'm right here, shoulder blade, back to balance, okay? I want to make sure she's looking ahead like so. The adjustment is 75% done. And watch, I'll go into position here. See how the elbow's back? She's balanced. I've got her. See the control I have here? Okay? Here. And then I want to talk about precision now. Many times, this is another big mistake, the chiropractor just puts their hand on their back somewhere. But there's a vertebra here. See? That's a vertebra, isn't it? And there's one right there. How about that? Was that sore at all? Not too much. How about this one? Good. And no. Right here. A little bit on that. That's L5 right there. But see, the thing is, watch this. Is my hand on that? It's not on it. It looks like it is, but I'm not on it. So we call it in winner's exercise, you got to aim. Okay, you got to get your soft piezoform. And here's what's happening right here, Brittany. It's that spot right there. I want to put that vertebra right in that little pad right there. Okay, so we have to aim. But the chiropractor just puts people down and they just put their hand like it's this random manipulation thing. And it's not. So if I'm going to do this for real, I'm going to have my fingers on her vertebra like this.
Okay, and I know when I come in like this, she will tell you now I'm on vertebra right there. See that? See that right there? Let me show you what I do here. You just hang out there. I'm palpating. I'll use the model here quickly. Okay, is I feel the vertebra, and then what I do is I replace my fingertip with my pisiform. See that? So I feel, and I've got it. Okay, and she'll say, yeah, that's it. And then I simply replace with my pisiform, and I'm underneath it just like that. You can't just put your hand on people's back in a random spot. Okay, if I want to be on an S2, I'm going to go down, and I'm going to replace like that. If I want to be up a little bit higher, I'm going to be here, and I'm going to feel it, and then I'm just going to replace my pisiform in place of where my fingertip was. Okay? All right, and then we're going to aim, and then we're going to be ready to go. All right, so now once again, straight, up, point of tension. I've got her knee here perfectly, but I'm not pushing too hard. Arms are good. Stabilization is in front. Okay, so we have good biomechanics. I'm here like this, and I can count. Okay, and she knows I'm being precise, just like the dentist checking your teeth. See, if I just lay her down and start doing something, it's a lot different than if I go, that's number 1, 2, 3, 4, and then this 5 right below it. It's very small like that. Okay, and I've got, see my fingertip here? Now watch, I'm going to replace it with my pisiform as I go into position. There, I've got it. And she knows I've got it, okay? And I've got just a little bit of room. My xiphoid is over the L5. Look at my nice angles, and it's easy, okay? Okay, come on, rock back up. You get really wound up, okay? it's kind of hard on the body. Okay, you can just sit and just chill for a second. I'll do a couple other things to wrap it up. Okay, so let me make sure here I'm covering everything, okay? Oh. The nevers. Never have the foot off the end, get it off the corner of the lateral malleolus. Never use your fingertips. Make sure the leg is straight. Make sure the foot is up high enough. Never just let their leg hang out. Always touch it with the top of your, right below your kneecap, okay? And then, of course, make sure we have the elbow back. Never have the arm like this. Never do you have your hand out of position. Never do we just put a random contact on there, okay? Never do we have their head looking up at the ceiling. Never do we go stand up here like this and like pull on their arm and then come back and put it into position. It's as simple and as precise as what you're seeing here, okay? Now I'm just going to go through this one last time, back on the other side, all right? And that'll be plenty for this, and then you can work on it, okay? So start to finish, just like it's a real visit. Great to see you, okay? Ear flat, okay? Bring it around like this, see that, right off the corner. This goes right to here. I push this down with my knuckle. I've got my kneecap. She feels comfortable. Shoulder blade down, back to balance. Her head's in position. We're ready to go. I'm here like this. I feel the vertebra. I know I can replace with my pisiform, or just like so, just like this. And I'm going to bring her to me, a little bit of stretch here, right? And I've got this space, but I've got her leg here. See that? I didn't, sometimes people roll over and see how your leg's not touching? She can go like this. You can never lose the leg. I have her leg. Your leg will not, see that? Her leg cannot go anywhere at any point. Sometimes the people have it here and they go to here and then you lose the leg. They'll have it the entire time. In fact, if I really need to put some oomph into this, by the way, as a side note, it's pretty easy to adjust people up to your body weight. To get above your body weight, you're going to have some skill or possibly move to an alternate technique. Just want to give you that heads up, okay? So here, never ever lose the leg. Right down with it, and there's a little bit of space here for my hip to give the power to cause the vertebra to move. Okay, up you go. All right, nice round of applause for Brittany. Thank you so much, okay? A couple other closing points here. Such important adjustments. Practically every ambulatory person on earth needs their low back adjusted on a consistent basis. And we just don't want to sell out, as you might say. And a sellout in this world is when you see somebody starting doing a bunch of kick moves. If I see 150 people in a day, I'll do 0. Like 0, not a single one. This is the ultimate. Why? Because the angles, the force, the power, all of that. And as soon as you get to kick, you're losing a lot of your angles. You're going for an easier technique because you didn't stick with the hard one long enough to get good at it. I was willing to not be good at something for years and stay with it until I finally was able to be really good at difficult techniques. So I'm encouraging you to stick with the stuff that's more difficult because the rewards are massive. Because once you have that skill, you have it forever. It wouldn't matter if it was golfing or if it was a martial art or playing an instrument or giving adjustments. It's the same thing. Go for the difficult stuff and stay with it until you're able to do it. I hope this has been helpful. If there's anything else we can do for you, you get a hold of us at winnersedgeconsulting.com.